Hello everyone, this is a video on clinical demonstrations on complete denture, part 5, wax try-in for complete denture. The aim for the wax try-in visits are to check the arrangements of the denture teeth and contour of the denture bases, and also to allow the clinicians to verify all the records that you took during the MMR visit with the wax streams are correct. These are the materials and also the instruments that you need to prepare during the visit. Try-in dentures is checked on the articulator before assessment in the patient's mouth. Check the pin to make sure the denture is mounted at the correct occlusal vertical dimension. Turn around the dentures to see if the denture is clean and neat. The occlusal plane is parallel to the denture base. Denture border is checked to ensure adequate extension to the sulcus width and depth. For maxillary denture, ensure adequate extensions to the maxillary tuberosity and hamular notch. For mandibular dentures, ensure adequate extension to 2/3 of the retromolar pad and lingual pouch. The base of the denture should be well adapted to the master cast. Run your finger on the denture border to check for wax residual which can hinder proper sitting of the denture. Remove the wax residual with a wax knife. Do the same for the upper denture. Next, we proceed with the intraoral examination. This is a checklist for intraoral examination. Insert the mandibular denture to check stability, retention and extensions of the wax denture. Normally, we will do this step during MMR and just to double check again during try-in stage. In this case, we are making a heat-cured base plate. Please note that if you are doing a cold-cure base plate cases, the base plate may not fit as well as the finished case. You can also use fit checker to check fitting surface and overextensions of the denture flange, depending on the cases. Use an indelible pencil to mark the overextension area and trim accordingly. Repeat the same for the maxillary wax trial. Mark the overextension area. Trim the overextended flange area accordingly. Next, insert the maxillary denture only and check the orientations of the horizontal and sagittal occlusal plane with a Fox occlusal plane and a ruler. The following step is to verify the OVD of the wax denture. Insert both dentures inside the mouth and measure the OVD with a Willis gauge. Remember, OVD plus intended freeway space is your RVD. OVD may change according to the vertical height of the denture, but the RVD never change. Next step is check occlusions and positions of the denture in patient's mouth. Instruct the patient to lift up the tongue to try touching the soft palate, and guide the patient's mandible to achieve centric relation. Ensure even contact on the occlusion in retruded position. Check with an articulating paper on both sides of the arch. Check appearance to ensure optimum OVD is achieved without straining of the facial muscles and adequate soft tissue support. Upper anterior teeth are set according to the smile line. Midline of the denture teeth coincide with the facial midline. Allow patients to check his appearance with a face mirror. Check the phonetic by asking the patients to count 1 to 10, 55 to 65, or pronounce Mississippi. These are the summary of the checklist that you have to go through when doing the wax try-in visit. And now you can send your denture to process for delivery. Remember to take the patient's identification number for denture labeling.